So this is Betty. She's a 42-year-old female who presents to try to improve the appearance of these areas right here. And like with a lot of people, she has some increased thickness of fat here as well as some loose skin. And she's a good candidate for Coolsculpting because there's not a lot of excess fat there. There's fairly small amounts. It's not a fat reduction plan, it's not a weight reduction plan, and it's not a way to lose inches. It's mainly to take care of those localized areas of excess fat that people want to get rid of, that are stubborn and not responsive to diet and exercise. And so it's nice in the fact that people can come in, spend a couple of hours, get the area treated, and then they will actually see noticeable results within about 2 to 3 months without any surgery or real downtime. And for most people, it does cost less than the liposuction. For the people who need more than 2 treatments, a lot of times they would actually be better off served with liposuction rather than with Coolsculpting, because the Coolsculpting isn't as aggressive and doesn't have quite as dramatic a result. In order to get the results that she would really like, she would probably need 2 treatments here because the thickness of the fat here is a little bit more than it is here. 1 treatment here. So on her initial treatment, she'd get 1, 2, 3, 4 applicators. And with the opportunity to apply 2 applicators at the same time with the dual sculpting, we could actually cut her treatment time in half. So Betty, what actually is going to happen on the day of the procedure, you'll come in and we'll actually put a guard down to protect the skin from the coldness, and then I'll put the applicators on each side. And for about the first 5 to 7 minutes, you'll feel coldness, but after that, you'll actually it'll become quite numb. And then once the treatment is finished, we'll remove the applicator and we will massage each area for about 5 to 10 minutes just to help break up some of the ice crystals that are in the fat to help maximize the destruction of the fat. And during that time, there can be some tingling associated with, and that goes away in a few minutes. And once we've massaged all the areas, you actually can just resume your normal activities and go back to work and exercise as early as the next day. Now, post-operatively, people do sometimes have some little bit of burning and a stinging sensation. That goes away in a few minutes, but the area itself will actually feel kind of funny with decreased sensation for up to several weeks, and it just kind of feels slightly abnormal, and that's just because of the nerves gradually recovering after having been frozen.